One of the most important things in Australia that you'll be doing whilst you start your first job is to work in the ED, that is the emergency department. And whilst you're there are certain critical things that you need to do or need to know in order to perform well. So let me take you through my experience from the past year where I actually did not know or wasn't competent in these things, and I learned that this is really important to upskill. So if you're taking up a new job in Australia, these will be the key 10 things that I'll let you know that you need to know. Now 5 of them are essentially critical and you need to know from the very first day of your job. The other 5, from number 6 to number 10, you can actually go through it as you work along, but if you know it from very start, that's very good. So let's start with number 1. Number 1 key thing is IV cannulation. Make sure you're competent, you know what sort of different cannulas are there. Some of them have locking mechanisms. Perfect your technique. Most hospitals have a mannequin where you can practice on, so make sure you learn through them. Number 2 is suturing. Every single time you work in the ED shift, you will get somebody who has either cut their hand, cut their head, had an accident, they need sutures. So simple interrupted sutures, if you know that, that should suffice for you. But if you know some other skills such as mattress sutures, that'll also help you. Number 3 is IDC, which we call as indwelling catheter. So catheterization for male and female patients, make sure you know that. Just be careful if you are a male and doing female catheterization, make sure you get a chaperone or a nurse to be over there. Most nurses are pretty good and they'll assist you very well. Okay, number 4 is wound dressings. You'll get a lot of people with cellulitis, wounds. You need to understand which wound dressings are the appropriate one. It's very basic. You can actually go to a wound care nurse in your hospital and they would be able to show you different dressings available in the hospital. Make sure you choose the appropriate ones. All right, number 5, ECG interpretation. Invariably, every single patient that comes to the ED will get an ECG, and you need to understand the basics of ECG. So there's plenty of videos out there. Make sure you familiarize yourself with the ECGs and get them organized. All right, number 6 is going to be chest x-ray interpretation. You don't need to understand everything about chest x-rays, but key things is picking out any masses, any consolidation or effusion. Those would be the 3 key things that you need to pick. Cardiomegaly and other sort of things. And another important thing that sometimes comes in younger patients is a pneumothorax. So make sure you familiarize yourself with those sort of things. Number 7 is going to be CT head interpretation. Now, you don't need to know everything about that, but 2 things are really important. Number 1, a subdural hematoma or a hemorrhage. So somebody gets a head strike, every single time in the CT they'll get a head scan or CT scan, and you need to understand how the subdural looks like. That's number 1. Number 2, any intracranial mass. So make sure you look at a few pictures and familiarize yourself with that. All right, moving ahead. Number 8, in my opinion, is eye foreign body removal. You get a lot of people with debris or foreign body in the eye. You need to understand how to use the slit lamp, how to use a burr to get the eye foreign body out. I actually didn't know it till I started the ED, but I asked one of my colleagues to show it, and you see it once and you try to do it several times and you'd get good at it. All right, now number 8 is going to be nail bed repair. So nail bed repair is really important to know. A lot of people will get nail avulsions, present to the ED bleeding. So make sure you've seen a couple of videos on how to do that. All right, number 9 is going to be joint aspiration. Some people may agree or disagree with this, but joint aspiration is an important skill to have. You'll get a lot of people with knee fusions, so make sure at least you know how to drain the knee. Would be an important thing. I think I've got the numbering incorrect over here, but one other thing that I would encourage you to use, the final one, is ultrasound. So make sure you familiarize yourself with the ultrasound. It's important to detect any free fluid. If you're doing IV cannulation in difficult patients, you can use the ultrasound guided cannulation. So those would be the key things that I would ask you to make sure that you get the hang of before you start your ED rotation. All right, adios. See you in the next video.